Welcome to the Darcy Wellness Show, where we present options for alternative and complementary medicine that are non-toxic, non-surgical and non-drug related for everyday problems. And today we'll be talking about arthritis. And with me in the studio is Dr. Kouch, Doctor of Chiropractic, Betty Wu, acupuncturist, Judy Fiatorone, licensed massage therapist and registered nurse. So welcome, guys. My name is Geoff Darcy. I'm an acupuncturist, herbalist, and director at the Darcy Wellness Clinic in Natick. Pheng, what is arthritis?
Arthritis, as the name implies, anything that ends in the letters itis, I-T-I-S, means inflammation of. And arthro is the suffix, it's the prefix that means joint. So it's inflammation of a joint.
And if we could go to our slide, there's a lot of Americans suffering with rheumatoid and osteoarthritis. So there are rheumatoid affects 2.1 million, osteoarthritis affects 21 million, and juvenile arthritis is more than 300,000. So if we go to our next slide, Pheng, the difference between osteoarthritis and rheumatoid arthritis.
Sure. Well, osteoarthritis is a degenerative condition where through wear and tear or trauma or hereditary factors, the joint becomes deranged and the joint spaces decrease and in
rheumatoid,
and in
the idea of
rheumatoid,
synovial inflammation,
right,
it really gets red and swollen and flares up.
Right. Rheumatoid arthritis is more of an autoimmune disorder where the body is literally attacking the joints and thinking that it's foreign and attacking those joints and causing inflammation.
Right, right. So in your chiropractic practice, you see a lot of arthritis.
Absolutely, absolutely.
So you will get arthritis of the hands or knees, but especially of the cervical, thoracic, and lumbar spine.
Right. Spinal osteoarthritis, also known as degenerative disc disease, is a very, very common problem. Upwards of 20 million people in the United States are affected with osteoarthritis, and once you reach past that 60-year-old age mark, that number really skyrockets to about 80% of that population.
So we're all kind of destined to head in that direction.
Pretty much, yeah.
And a lot of also it is caused by taking a knock earlier on in life, not looking after it, an athletic injury.
Oh, absolutely. Trauma early on in your life can definitely manifest itself as degenerative changes later on in your life.
Yeah, I remember a chiropractor reading my spine and saying, yeah, that looks like an old rugby injury here. This could be an old soccer-related injury there. So those, Betty, from a traditional Chinese viewpoint, those areas when they receive that trauma sets up stagnation, that blood doesn't get through in the same area as well, or energy, from an acupuncture perspective, doesn't get through to that area in the same degree, and then it starts to, the joint starts to not be nourished and disintegration kind of follows. So you in your acupuncture practice see a lot of acupuncture. How do you treat it?
Well, we have to, excuse me?
A lot of arthritis, excuse me.
Yeah, well, in Chinese medicine perspective, arthritis is more predisposed by what you talked about in terms of old injuries. The way we see arthritis is really a painful syndrome, and with that is blocked qi in that area. So let's isolate it and we'll talk about the shoulder, where you have an injured shoulder, and the way to treat it is we go locally and insert needles in there to increase qi, because when there's blockage of qi, there's pain. So we address the symptom and then strengthen the body by treating the root. So basically, it's the same as what he explained, but a little different in terms of how we see it as a painful syndrome.
So a football player, taking a hit from somebody's helmet into the shoulder, and it never quite recovers in terms of the energy flow, or maybe in terms of blood flow also.
Right, right.
That can lead and predisposes later on towards that area becoming arthritic.
Right, right.
Yeah. So how many arthritis in your practice do you see, Pheng? I mean, is it sports related? Is it more just age related?
It's a combination. Many patients are former athletes, or at least have had accidents, motor vehicle accidents, skiing accidents, slip and fall accidents, you name it. It's pretty much happened to one person or another, and that all those traumas, once
they accumulate.
Once they
add in,
accumulate, they add up and
Yeah.
will lead to what we see when the patient presents.
Okay, if we
to the
could go
clinic.
to picture of the ugly arthritic knee that's coming up next that you gave me. So maybe just explain a little bit about what's happening here with the arrow pointing at the knee.
Sure. The arrow is pointing at the medial side of the knee, and what you see there is significant decreased joint space at that medial.
So it's like the cartilage is kind of caved in or is
Right.
worn out.
through wear and tear of that knee,
Yeah.
whether it be trauma or constant repetition.
Right.
The cartilage wears out to a point where the knees, the tibia and the femur are almost rubbing bone on bone with one another.
Yeah. And that's where the supplements like glucosamine come in, because it's a membrane fluidizer. So when the joint would be bone on bone, if you can just get a little bit of moisture into the membrane at that area, it provides a little buffer. So glucosamine, chondroitin are also supplements that are especially useful for bone on bone type of pain. So Betty, what would you have done with that knee? Somebody comes in and says, "Got a terrible pain here, arthritis. I've been taking pain relievers for years and it hasn't helped." If I walked into your practice, how would guide me through what you would do? You would take a questionnaire, you'd do an exam?
Yeah, basically do an intake and diagnose what you come in for in terms of the knee. We'll have to determine what kind of arthritis it is. Is it a fixed arthritis? Is it from damp? Is it from cold that triggers that pain?
Because the idea of weather, we hear all the time in our practices that, that it is worse in damp weather.
Right. So we determine that.
So in Chinese medicine, there is actually a category that is called damp.
Right,
blocked
damp B.
energy flow, and it's blocked by the dampness.
Right, and some of the symptoms with the dampness is that there's fluid in the knee that just never recovers.
Yeah.
So we will needle most likely right at the local spots, and that will help drain excessive fluid that's built in there, increase circulation, and really put some heat on it because heat will dry.
Yep.
And then do some distal points to really strengthen the body to
Right,
heal. Because as we get older, we're tendency to be more deficient. So that healing process takes a little longer than a child who comes in for an injury.
Because they've got a lot
young
more
athlete.
energy, they can heal. They can knock that injury out of there in no time at all. But as we get older, the repair processes are slower.
Yeah, and I'll have the same patient come in, and next week she'll say, or he will say, "My knee feels better."
Yeah.
And then they'll look out the window and it's a sunny day.
Right.
So it's not rainy.
Right.
So that you have to factor that in. But at the same time, they do progress well in terms of the treatment, and adding herbal supplement in there, such as Inflamease or Joint Ease or Joint Cool.
So Inflamease is a formula that has a lot of herbal anti-inflammatory compounds in it, and we give it. It's coming from a martial art formula, so traditional Chinese formula. It is given for acute phase kind of inflammation. So you use Inflamease.
Yeah, Inflamease and Joint Ease or Joint Cool.
Joint Ease is another formula actually that came from the idea of arthritis that flares in cold and damp situations, which is the kind of arthritis from a traditional Chinese perspective we see all the time in the Northeast, is because we're in a cold, damp environment for most of the year.
Mm-hmm.
Yeah. And Judy, so somebody walks in and they've got arthritis in the lower back. As a massage therapist, how would you approach that?
Well, the same idea. Would have an intake form, see what medications they're on. A lot of times they'd be taking the NSAIDs or the like aspirin.
So NSAIDs is the non-steroidal anti-inflammatory compounds that are very commonly given out.
Yeah, or aspirin. A lot of people are still on the aspirin. And there'd be precautions with that for bruising. You could have very thin skin, and you have to be careful with that. But for the most part, with massage, it's more like muscle and...
so any kind of armoring that forms around the joint,
yeah,
spasms.
because anything, ligaments will tighten, the muscles will tighten. So It's more of an overall, you wouldn't just work the knee, you
Yeah.
know, I mean, it varies, but everything's connected and with fascia, so sometimes it depends on...
And just getting more blood supply
yeah, you want to
into
get
the area
circulation
also
there.
is going to help.
Yeah.
Yeah. So there's an interesting study that they did recently where the respondents for arthritis, who had arthritis, 2/3 of arthritis patients had tried some sort of alternative complementary medicine, including chiropractic, herbal medicine, vitamins, and acupuncture, as well as different types of diets. So if we could go to our next slide, and this is really a shocking figure that came out of a study that was published in 1999 in the New England Journal of Medicine, and basically shows that, you know, the commonly used non-steroidal anti-inflammatory drugs, you know, like Advil and Aleve and Nuprin, Motrin, you know, that we're encouraged to take like candy on every commercial on the TV these days, that these non-steroidal anti-inflammatories were actually responsible for 16,500 deaths each year. And what happens is these non-steroidal anti-inflammatories are destroying the intestinal bacteria and the bacteria that protect the coating of the stomach. So oftentimes most of those deaths were in the elderly and people who used those medicines repeatedly over time and had some sort of a bleed out episode, you know, from the intestine. So there is a risk, Pheng, and
Yeah.
you see that all the time, that people, you would, I'm sure, refer people to alternative
Sure.
complementary therapies first. I mean, if you need it, you need it. But
If I can comment on that study, if I'm not mistaken, that study, that 16,500 number is just the number of patients with osteoarthritis, diagnosed osteoarthritis. So this is prescribed non-steroidal anti-inflammatories, not over-the-counter non-steroidal anti-inflammatories that many in the population just go on their own and go by the...
So those are the ones they could track.
Exactly. Those are just the ones that they can track.
So it's the tip of the iceberg more than likely.
Yes.
Yeah.
And...
so the idea of combining, you know, chiropractic, massage, acupuncture as, you know, alternatives to just making do, trying to take a non-steroidal anti-inflammatory, hope that the pain goes away, is not really getting to the root cause of arthritis.
Right. Well, what happens when, for instance, let's take an example of a low back. When there's arthritis in a low back, there are many things that happen before that arthritis set in the first place. Arthritis isn't one of those things where you don't have it one day, you have it the next day. It's a process. So, for instance, early on in your life...
It's a process of degeneration.
Exactly, exactly. And what happens is when a joint is injured, for instance, the posterior joints in the back here, also called the zygapophyseal joints, when these joints are injured...
Can you say that 3 times?
The zygapophyseal joints are injured, the muscles surrounding the back go into this really extreme spasm.
Which is what Judy was saying, that she often will treat arthritis patients for spasm and tension around the area.
And there have been a couple studies on rats where they immobilized some of the spinal joints in these rats, and within literally a couple of weeks, they were able to see degenerative changes taking place on X-ray, things like some chondrosclerosis, where the body comes in and lays down bone in that area to buttress that area. What they also find is that...
So why would the body do that? Is it trying to add in extra structure to an area that's compromised?
Exactly.
Yeah. And then that process kind of goes awry.
It goes awry.
Yeah.
That's exactly what happens. And when those muscles go into spasm, the whole area, all those joints in that area are literally immobile. And when immobility sets in, arthritis sets in...
So that's the stagnation. The blood flow isn't going in. The energy flow is not going in.
Right. As what Betty was saying, yes, that's that stagnation going on.
Yeah.
And what chiropractic does, and why chiropractic is really beneficial for arthritis, is because we can get in there and decrease that muscular spasm so that joint starts to move better. You know, we're not necessarily going to...
So you're encouraging the joint to open up.
Right.
How is that done? By taking pressure off of the joint from a better alignment further up the spine?
Well, not exactly. When we adjust an area of the spine, say a low back, for instance, when we put an adjustment into that joint, we set off this the scenario where the joints, when we adjust the joints, signals are sent to the brain and signals come back from the brain down to the muscles in that area, telling those muscles to relax. And once we do that enough times, the body actually kind of understands that and loosens up those muscles and decreases the overall tone of those muscles.
So that takes us out of the cycle of inflammation
and pain, inflammation, spasm
yeah.
Cycle.
So tell us a little bit, Betty, about a patient. Can you think of a patient just to show how acupuncture worked through and was very successful?
Well, I referred a patient to Pheng. We actually worked with her together. She came in with neck pain, cervical pain, just on pressure. She can't hardly move, stiff neck. I treated her. She got some relief. She didn't do too well. She came back for several more treatments, and I said, well, let's combine this with chiropractic. And so Pheng took her on, and we both worked with her, and she actually, the outcome was much better.
Yeah.
But we really had to put those treatments together, back-to-back treatments, in terms of
So
release.
you think people might be thinking that chiropractic, might be very painful on an inflamed, stagnated joint. I mean, how I can understand how acupuncture would help the pain, help the blood flow, increase the energy flow. How do you adjust a painful joint?
Quite easily, actually.
Yeah.
It depends. If there's a real lot of muscle spasm, that's slightly different. But most times when people come in, they're not so far acute that you can't do anything.
Right.
And the idea.
So people shouldn't be fearful that.
No, absolutely not.
If you've got a painful joint, you're going to snap them and crack them and cause more pain.
Right. No. Usually, when patients come in acute, the relief is quite instantaneous.
Yeah.
Most of the time.
Yeah. So Betty, you were saying that the treatments, you work together with the acupuncture and also by helping to open up the joint.
Right.
With
When she
chiropractic.
came in, she was not able to really turn. Her flexibility, mobility, range was not there. So I was able to do really local points in the neck because it wasn't inflamed really. It was just stuck.
Yeah.
So I treated with the needles, really local points, distals as well. She was able to move her neck, feel better, and be more open to an adjustment.
Right. So the idea with the, I find all the time also with patients that I refer to Pheng is when you can take away the inflammation and the spasming, then the joint is more amenable to be adjusted because it doesn't have the armoring that's going on. The acupuncturists help melt that away to make your work better chance of actually making that adjustment and having it go in and stay in.
That's why acupuncture is such a great adjunct to what we do. You guys are able to get in there and decrease some of that muscular tension so that we can more easily make that adjustment.
Yeah. So Judy, with the pain of arthritis, you work a lot with the pain of arthritis with massage. I mean, is it helpful, or is massage ever contraindicated?
Well, it is, like I said, with someone on aspirin or, the NSAIDs. But for the most part, I think with, it's more of a relaxation. If muscles are tense, they're going to pull on the joints and, set up for pain and spasm and whatnot. With massage, and, that varies too. There's many different techniques with deep tissue or the classic Swedish, which really relaxes muscles. When
all the Swedish people get a lot of massages.
I know, they really
a small nation with a big massage house.
Everyone loves the Swedish massage. But that's a very different kind of relaxing type of massage. And with the relaxation, it's not going to have that much pulling on the joints. And there's also, with exercise, very gentle exercise to kind of gently pull the muscles, the joints, just to get circulation in there. And, but again, it varies,
Yeah. If we could go to our next slide. This was a study that came and said 73% said that chiropractors were very helpful for arthritis. And nearly half the respondents reported turning to alternative therapy. just because their prescribed medications were ineffective. There's not much in the armory apart from management of pain and somewhat of inflammation. So when they come in for chiropractic, are you also recommending other things like liniments or ice on a regular basis to try to control the inflammation?
Sure.
Or does that increase the stagnation even more in the area?
That's a great question, and there's
double-edged.
there is a lot of conflicting points to that.
Yeah.
There is, especially with chiropractic.
I know the acupuncturists, us
acupuncture.
acupuncturists, we love heat. And
Right,
getting
you guys
heat,
love
and
the
we
heat?
only use cold in case it flares up to shut down, whereas there are different philosophies.
Right.
Yeah.
Well, definitely during the first 24, 48 hours,
Yeah.
ice is almost always recommended on my part.
Yeah.
And, even though it does cause a little bit more muscle splinting and spasm, the benefits of decreasing that inflammation and driving it out,
Yeah.
For me, is more important than that muscle spasm at that particular
Right,
junction.
right.
As we go down the line, 3 or 4 days into it, a week into it, we'll definitely have them switch off
Yeah.
into doing some heat or possibly even some contrast therapy where
Right.
we're doing some cold, then heat, then cold, then heat, something to
And
that
all
effect.
of that stimulates blood and
Exactly.
blood movement in there. So the idea then of if we could go to our next slide is this shows the inflammation, how it torques the joints in the hands out of alignment. We've seen, I think most of us have seen arthritic hands where the knuckles are twisted. So over time, buildup of calcium on one side of the joint or will deform the joint. And Betty, I know in my practice I use herbs and acupuncture, but also heat. I remember for a cold, from a traditional Chinese viewpoint, diagnosing somebody as having a cold, damp arthritis, and we had them one winter put their hands every day into a paraffin bath. I think it's a cosmetic treatment, isn't it? I think for the skin of the hands. But we had them do it for the arthritis, plus the constant anti-inflammatory herbs and regular acupuncture, and they did really well with less pain. Obviously, the deformity of the joint is not going back to normal if it's been there a long period of time. But what other things do you bring in? Do you heat the joint up? Do you add, do you have them rub liniment in? Any other adjuncts that you add on top of the acupuncture?
Well, on top of the direct insertion into the hands, I use the infrared heat lamp that we have in the office, as well as moxibustion.
So tell us a little bit about moxibustion.
Well, moxibustion is an herb that is, there's some smoke, there's some smokeless. I tend to use a smokeless one, and they come in a stick.
So it's like a herbal cigar.
Yes, herbal cigar. And I light it, and basically I either heat the needles so that the needle can penetrate the heat in through the hands.
So that as you warm the needle up, if the needle is in a half inch, that's taking that heat down into the joint.
That increases the heat and then increases circulation.
Right.
And if the person or the patient that I think can handle this at home, I will show them how to do it, and they actually bring the moxibustion, the herbal cigar, and they will do that themselves at home to increase the efficacy of the treatment when they come back.
So if we could go to our next slide, my first team as far as recommendation of herbs and supplementation is glucosamine, which I think is much more effective than chondroitin. I think the jury is still out on the evidence, but there's some very good studies on glucosamine sulfate right now to help provide membrane fluidizing the membrane to help provide some sort of buffer between bone on bone. Then the joint ease is a herbal formula that we take in high dosage for the first couple of weeks just to try to get the inflammation down and then support the body with calcium and magnesium. And on the rare occasion when it's really flaring up, we will add in an anti-inflammatory herbal formula. And if we could go to our next slide, we actually see the moxibustion happening on the needle. So the top picture is a knee with two needles stuck in it, and then on the ends is a moxibustion. It's a little bit of that herbal cigar cut off, put on the edge of the needle. That's burned, and it gently warms the knee, and it's extremely soothing, wouldn't you say, for cold, damp arthritis?
Oh yeah,
it's
absolutely.
very soothing. So this is a very interesting study, a very large study that was done quite recently. And what it showed in this acupuncture study for osteoarthritis of the knee was that 44 over 5 weeks showed some reduction in pain, and that 40% had a major improvement in the mobility of the knee. So what that suggests is the whole inflammatory process around the knee has kind of shrunken down, allowing the mobility to happen much easier. And our final slide, so the mechanisms, Judy, of massage. There's somebody coming up right now who has a very serene face on this slide. So all your patients look like that, I'm sure, right?
Yeah, I
very
wish.
serene,
Usually
peaceful
they do.
That's calming massage.
But again, massage takes care of the muscles around the joint. You're not going to massage right on the joint. So it's would be the muscles and tendons and ligaments that you would manipulate around the joint. Again, that's for increasing circulation, the range of motion, and you just want to get that joint kind of gently moving again so it doesn't get into that bind.
So Betty, just to sum up here, I mean, we have some great tools in our clinic, Darcy Wellness Clinic in Natick. We have some great tools to treat arthritis. I mean, what would you say just to sum up about acupuncture?
Well, I want to say definitely try acupuncture, because the fact that you can try acupuncture and not take drugs.
Yeah,
that's the first stop. The other one I want to emphasize is educate yourself or your family so that you don't have these injuries and let it linger. And then as you get older, those are the factors that will trigger.
The consequences.
Yeah, consequences, so acupuncture, herbal, it's I mean, I've had good success with it.
Yeah. So why wouldn't someone try it rather than go for drugs, I mean, or even surgical options? Why wouldn't you try it first and see how far it would go, would be my comment.
Well, because it's not mainstream.
Yeah.
It's not mainstream, and drug is the first choice by doctors.
Yeah.
So I again, look at all the resources, educate yourself, and see what works best for you.
And Dr. Kouch, chiropractor extraordinaire, how would you sum up?
Well, chiropractic for arthritis is definitely something that you should definitely try before attempting any types of surgery or taking any types of pain medications or muscle relaxants.
That's right. What's to lose? A few visits to see if it helps.
Sure. And oftentimes patients who require surgery, up to about 40 or 50% of them can not have to go through with the surgery when they try the chiropractic first.
That's great. And if we could go to our final slide, so anybody wants to get more information, they can go to darcynaturals.com. There's some information on rheumatoid arthritis and the herbal treatment, and also osteoarthritis, the herbal treatment. So Dr. Kouch, Dr. Pheng Kouch, chiropractor, Betty Wu, acupuncturist, Judy Fiatorone, licensed massage therapist and registered nurse. Thank you very much for joining me on our panel discussion for acupuncture today. And from myself, Geoff Darcy, acupuncturist and herbalist and director at the Darcy Wellness Clinic, I want to thank you very much for joining us. I hope you've learned something tonight about non-drug, non-surgical, non-toxic options of treating arthritis. So thank you very much for joining us, and we wish you and your family all the very best.